Here is the rewritten script with all instructions followed strictly. Right now, there is a deliberate and calculated effort underway to strip benefits away from the most vulnerable people in America. And if you are collecting Social Security, SSI, or any government benefit, you need to hear this because what is happening behind closed doors could directly affect the money you depend on to survive. This is not speculation. This is not fear-mongering. This is a real proposal working its way through the federal budget office right now, and if enough people do not know about it, if enough people do not speak up during the public comment period, it will pass without resistance. That is exactly what they are counting on. They are counting on you not understanding the complicated language, not knowing where to look, and not taking action until it is too late. Let me break this down so everyone understands what is at stake. The person currently running the Office of Management and Budget was one of the primary architects of Project 2025. This is the same project that certain politicians swore they had nothing to do with, and yet here we are with one of its designers controlling the federal budget. This individual has made it abundantly clear through his career that he opposes virtually every social safety net the government provides. If it does not benefit the wealthiest people in this country, he wants it gone. So what exactly is the proposal? It targets SSI recipients specifically. For those who are new here, SSI stands for Supplemental Security Income. It is a needs-based program administered by the Social Security Administration, but it does not come from the Social Security Trust Fund. It comes from general taxation. To qualify, you must have extremely low income and extremely low resources. If you are single, your resources must be under $2,000. If you are married, under $3,000. The maximum benefit you can receive from SSI this year is $994 per month. That is it. That is the ceiling. And many of the people receiving this are elderly individuals 65 and older who have no other means of support. Now, here is what happened a couple of years ago. Congress recognized that hundreds of thousands of SSI recipients were living with family members or friends because they simply could not afford housing on $994 a month. These families took them in out of compassion. They offered a spare room or a couch. Previously, Social Security would calculate the market value of that room, say $300, and deduct it from the SSI recipient's benefit. So if Grandma was getting $994 and her daughter let her stay in a spare room worth $300 on the open market, Social Security would reduce Grandma's check by $300. The regulation passed a couple of years ago created an exception. It said if the household providing that room is already receiving SNAP benefits, meaning food stamps, meaning they are already verified as extremely low income, then we should not penalize the SSI recipient for staying there. The logic was simple. If a household is so poor they qualify for food stamps, they clearly are not profiting from housing an SSI recipient. They are just trying to help a family member survive. The new proposal wants to eliminate that exception. They want to go back to counting that in-kind support against SSI recipients, even when the household helping them is barely surviving on food stamps themselves. This is one of those changes buried so deep in regulatory language that most people will never understand what happened. They read about ISM, which stands for in-kind support and maintenance, and SNAP benefit interactions, and their eyes glaze over. That is intentional. The more confusing they make the language, the fewer people fight back, and the easier it is to quietly cut benefits to people who have nothing. If this goes through, people who were getting subsidized housing from struggling family members will lose however much Social Security determines that housing is worth. It could be $200, $300, or even more taken directly from their $994 maximum. For someone living on that amount, losing $300 is catastrophic. Right now, this proposal has to pass through the budget office and the administration before it moves to the public comment phase. A coalition of lawyers across the country is watching this closely. If it advances, the public will have an opportunity to comment, though sometimes the administration opens public comment, receives overwhelming opposition, and proceeds anyway claiming they fulfilled their obligation to listen. But we still have to try. We still have to flood those comment periods and make our voices heard. This brings me to something important. We need to be more organized about protecting each other. Every single day, people need to report what is happening on the ground in their communities. Think of it as a field report. If you are being denied benefits, if your SSDI or SSI is being cut, if your Medicaid is being downgraded or terminated, if you received a continuing disability review and were denied, if you cannot get through to Social Security by phone, if you cannot get into a field office, if you received a letter you cannot understand, if you encountered a scam, report it. Put your state and a brief description in the comments. That way, everyone across the country can see what is happening in different regions and prepare accordingly. The continuing disability reviews are going to be a massive problem. They changed the procedure a couple of months ago, and it is going to create chaos for people currently receiving disability benefits. If you received a CDR and were denied, we need to know about it. The One Big Beautiful Bill is going to devastate Medicaid and snap in multiple states. Some states are already seeing 17% cuts. The claim was that these cuts would remove undocumented immigrants from Medicaid, but here is the truth. If you are undocumented, you cannot legally receive Medicaid. That is federal law. Some states provide health coverage from their own state funds, but Medicaid itself is illegal to provide to people who are not in this country legally. So who actually gets hurt by these cuts? American citizens, elderly Americans, disabled Americans, children. Millions of people have already been kicked off food stamps. Children are losing access to food assistance. This creates a domino effect. People lose Medicaid, so they stop going to the doctor, but they do not stop getting sick. They end up in emergency rooms, cannot pay, hospitals raise prices for everyone else, and even people with employer insurance see their costs go up and their wait times increase because emergency rooms become the primary care option for millions of uninsured people. Now let me shift to some critical Social Security information that can help people right now. First, disability benefits and the date last insured. If you have not worked in 6 to 10 years and you want to file for Social Security disability, you need to understand that disability requires two types of insurance. You need to have paid into Social Security for at least 10 years total, and you need to be currently insured, meaning you worked 5 out of the last 10 years. But here is the key detail. It is 5 out of the last 10 years before you became disabled. So your date last insured, called your DLI, is calculated based on when you last met that requirement. If your disability began before your DLI, you may still qualify. Always ask Social Security to calculate your DLI when you file. You can file for retirement benefits and disability benefits simultaneously. This is called a RIBDIB, which stands for Retirement Insurance Benefits and Disability Insurance Benefits filed together. If disability is denied because of your date last insured, you still have your retirement claim in place. For people living abroad, if you are a United States citizen receiving SSDI, you can live virtually anywhere in the world and continue collecting your benefits. The exceptions are North Korea and Cuba. If you are a green card holder, there are more restrictions. A smart strategy for Americans living overseas is to set up a virtual post office in the United States. These services receive your mail, photograph the envelope, and let you decide whether to open, scan, or discard it. You give Social Security your virtual post office as your mailing address, so you never miss important correspondence. Regarding the earnings limit, if you start Social Security benefits mid-year, Social Security does not care what you earned before your benefits began. They switch to the monthly earnings limit for your first year. This year, that monthly limit is $2,040. As long as you stay under that amount each month from the month your benefits start through the end of the year, nothing is withheld. The key is making sure the Social Security employee codes your non-service months correctly in the system. Tell them to code the NSM correctly. When you use that terminology, they will double-check their work because they will know you understand the system. For people on SSI who turn 62, Social Security will require you to file for retirement benefits. If you are eligible for any Social Security benefit, whether retirement, spouse, or survivor benefits, you must claim it. SSI is the payer of last resort. If your retirement benefit is less than $994, SSI will top it off to reach that maximum. The transition between the two systems sometimes causes temporary overpayments or confusing letters because the Title II unit handling retirement and the Title 16 unit handling I do not always communicate in real time. If this happens to you, let the process work through. The systems will reconcile. For people on SSDI who want to try working, Congress created the trial work period. You get 9 months to test your ability to work. During those 9 months, you can earn any amount without losing your disability benefits. If after 9 months you determine you cannot sustain employment, you simply stop and your benefits continue with no penalty. If you do successfully return to work and your monthly benefits stop, your Medicare continues. Congress recognized that many people can only work because they have Medicare covering their medical needs. Taking away their health care would force them back onto disability, so they allowed Medicare to continue even after cash benefits stop. Regarding residual income, if you previously sold insurance policies or did work that generates residual payments, those residuals generally do not count as work activity because you are not actively performing services to earn them. This applies to many situations, including acting residuals, insurance renewals, and similar passive income streams. For surviving spouse benefits, if you are on SSDI and become eligible for spouse or surviving spouse benefits, you do not lose your disability. You do not lose your Medicare. The benefits are combined. If your SSDI is $1,000 and you are eligible for $500 from a spouse record, you receive both. One offsets the other in terms of the total calculation, but your disability status and Medicare remain intact. A critical point about survivor benefits and delayed retirement credits. If your spouse delays collecting Social Security past their full retirement age, they earn 8% per year in delayed retirement credits up to age 70. When they pass away, those delayed retirement credits transfer to the surviving spouse. So if someone's full retirement age benefit is $1,000, but they wait until 70 and it grows to $1,240, the surviving spouse can receive that full enhanced amount if they claim survivor benefits at their own full retirement age. The 9-month marriage requirement for survivor benefits has exceptions. If the death was accidental or if the deceased was on active military duty, the 9-month requirement can be waived. However, the active duty requirement is specific. If someone was exposed to burn pits during service but passed away after leaving active duty, Social Security may deny the claim under current regulations. In that situation, file a reconsideration using Form SSA 561, expect it may be denied at that level, and then take it to an administrative law judge who has more latitude to interpret the law's intent. Also, contact your senator because these cases highlight gaps in regulation that need to be fixed. For people approaching 65 who have been on Medicare through disability, you gain access to Medicare supplement plans, also called Medigap plans, without health underwriting during your open enrollment period at 65. If you have been stuck with a Medicare Advantage plan with limited networks and prior authorizations, turning 65 opens the door to Plan G or Plan N supplements that give you broader access to healthcare providers. The Medicare Savings Program is another benefit that millions of eligible people never claim. According to the National Council on Aging, over $30 billion in benefits go unclaimed every year. If you have very low income and resources and qualify for higher levels of Medicaid, your state may pay your Medicare Part B premium. That is over $200 a month you do not have to spend out of pocket. For people who have both Medicare and Medicaid, You may be eligible for a dual eligible Medicare Advantage plan that provides extra benefits like transportation, gym memberships, flex cards, and grocery allowances. However, if your Medicaid gets downgraded or terminated because of the funding cuts from the recent legislation, you lose dual eligibility and all those extra benefits disappear. That single downgrade can cost someone $400 to $500 per month in lost benefits and increased costs. Here is what everyone needs to understand about the Social Security Trust Fund. We have approximately 79 full monthly checks remaining based on the most recent trustees report. After that, if nothing changes, everyone receiving Social Security will see a 23% cut. This is not partisan. No administration over the last 40 years has fixed this problem. Some proposed solutions, none followed through. The trust fund has not been stolen. Every dollar is accounted for in the annual trustees report. But the clock is ticking, and pretending the problem does not exist is not a solution. The people who want to privatize Social Security are counting on inaction. They benefit from the trust fund running dry because it creates the crisis they need to justify dismantling the system entirely. The only counter to that is organized public pressure on elected officials. Call your senators and representatives. Tell your friends to call. Tell your neighbors. We want Social Security fixed, not privatized, not gutted, fixed. Trickle-down economics has been the policy approach since the 1980s. We have been giving trillions of dollars to the wealthiest individuals and corporations for over 4 decades with the promise that prosperity would flow downward. It has not. Income inequality has grown worse every single decade. And now they want to cut $994 from elderly people living on couches while handing another round of tax breaks to billionaires. At some point, doing the same thing over and over while expecting different results is not economic policy. It is something else entirely. Protect your benefits. Understand your rights. Report what is happening in your community. If you get a strange letter, share it. If you get denied, appeal it. If you see a scam, warn others. We are stronger when we share information and look out for each other. Take care of each other, stay informed, and never let complicated language stop you from fighting for what you earned and what you deserve. Social Security Decoded.